Injuries can be the most frustrating part of playing sports. Today I'm interviewing physical therapist Dr. Emily Skipper, who helps you get back in the game. Welcome to the Change Up Impact podcast, where we showcase stories of inspiring professionals while highlighting the universal principles of success. Today I'm joined on the podcast by Dr. Emily Skipper. Emily, welcome to the show.
Hey Derek, thanks for having me. Really appreciate you have or letting me be a guest on your podcast today, and looking forward to some good conversation.
All right, I'm excited. Looking forward to again digging in with you as well. Let me let everybody listening in know a little bit about your background. And if you're tuning in and you have questions from a physical therapy perspective, feel free to put those into the chat. Maybe I could put those up on the screen and we can have a little bit of a spontaneous dialogue as well. But if you have any questions for her about an injury, or if you know a family member who's had an injury in the sports world and they're trying to get back on the field or back on the court or back in the game in any manner, feel free to let us know so we can make that connection between you and Dr. Emily Skipper here. To give you a little bit of Dr. Emily's background, she's a sports physical therapist that works for Puckett Physical Therapy. She is a sports residency trained and is passionate about working with athletes of all levels, rehabilitate and build performance after injuries to help them get back to sports and activities they love. Emily, let's just jump off from the get go and ask you, what do you enjoy most about being a physical therapist?
I would say, for me in particular, one thing that I enjoy most about being a PT is being able to help people when they're at their lowest point. Especially
Yeah.
working with athletes when they go through a specific injury. Obviously, that's really difficult for them. If you think about, young athletes to even adult athletes, kind of that middle-aged population, for most of their life, they've identified themselves as an athlete. So when you have an
Mm,
injury that, takes that identity away from them,
sure.
obviously that's a big impact on their life. So something that I really enjoy in being a sports PT is helping find that again. Being able to be their main support system through
Yes.
rehab, even having some emotional support as well, um, and just everything along that aspect. So, I love being that guidance point, helping them overcome obstacles of kind of unexpected trauma that's happened to them. It's very rewarding and something that I'm super passionate about.
Yes, yes, yes. This is kind of a sidebar, but related to all of this. I appreciate you talking about identity and how people associate, like, really their performance with who they are, their confidence, their self esteem, their whole being with the sport and being able to perform at maybe, a potentially high level, depending on what level that they're in. Even if it's high school, but it's still like you're in some ways your whole life revolved around a sport, or college, or professional, even more so. Um,
Absolutely.
but I remember, so the sidebar I was going to mention, which was, I remember like when I was in college and I went to this evangelism seminar like in my church group, and they were talking about like which
Yeah.
is which thinking about it now sounds low key manipulative, but what they said then was like pray for broken bones, which was like if you do that, then you'll in some ways, not that's not the manipulative part, but athletes who are injured are can be the most lost because they're struggling with that identity. They're struggling with who they are. They're struggling not being again that elite top performer during that injury. But I'm saying all that because I know this is not a church evangelism podcast, but this is showcasing your story. But I could see how you're able to provide value to help them to regain that confidence, to regain the identity of being an elite performer.
Yeah, absolutely.
Um, now, I know you mentioned a little bit of this. Is there a specialty that your business focuses on?
Yeah, so definitely kind of alluded to it already. Most of our patient population, or if you kind of prefer the term clients here, is going to be related. So we do pride ourselves in providing sports rehab. That's where my passion is. That's where my boss's passion is. That's kind of how he built his business that I'm fortunate to be a part of. So again, sports rehab is what we focus on specifically. We also do performance training and injury prevention as well. So something that we really value is the idea of being proactive versus reactive.
Hmm.
So if you think about just like physical therapy as a profession, is kind of built around the idea of being reactive. Of somebody gets hurt, or if you go away from the sports side, someone has a stroke, or someone has traumatic brain injury, or
Yeah.
even just your common everyday things of neck pain, back pain, knee pain, shoulder pain, which we hear all the time. Again, now they're coming into us for the idea to be able to help them get them back to whatever activity. In the sports world, I think it's huge to be on um, that proactive side, like what
Sure.
can we do to prevent injuries from happening. Especially in the high school age population, way too many injuries happening, unfortunately.
Yeah.
So that's something that we also like to kind of market and build upon, of what kind of services can we provide to kind of be that gap of what's missing in terms of prevention train or injury prevention, and then also performance training when we're on the other end of injury. Let's say they have rehab something specifically, we don't want to just send them off and be like, okay, you're good to go. We want to continue to build their performance to make sure that it's not something that continues to reoccur.
Hmm.
Something that our business in particular that kind of sets us apart from other clinics is we are located in a athletic kind of a youth athletic performance center. So we have access to 30 yards of turf. We have a half basketball court, and then fully equipped weight room. We have BOSU balls, plyometric boxes, Vertimax, sleds, all kinds of things. Pretty much, most of the things you could think of that you expect to be in kind of like a gym-based setting is we have it.
Yeah.
And this is something that is extremely important when it comes to the idea of sports rehab. Athletes need to be challenged much more than your just kind of everyday average person. So them going into your traditional PT clinic and not being challenged in that way because they don't have either the equipment or the facility, the space, the time. It's kind of a disservice really to athletes because you're not getting them to the level that they need to be. So if
Hmm.
you think about, again, sports put a pretty high demand on the body.
Yeah.
That's very different than just our everyday activities that we go through. So we need to be able to prepare them for high level activity. And then, something else that's also very helpful is being able to train in their environment as well. So,
Mm.
when I'm working with a basketball player, a lot of times we're doing things on the court, or if I'm working with a soccer player, we're doing things on the turf field. So again, you get the added benefit of being in their familiar environment as well.
Yes, yes, yes. No, I've seen some of the videos. I think when I first met you, and I think I was hearing about it, like I think there's one image or idea that came to my mind about what the clinic was gonna look like. But I think I remember seeing some of the videos online and go, oh, like, hey, there's a bunch of workout stuff, like a ton of stuff. There's the field, there's the
Yeah,
basketball court, all these things. Like, oh, okay, like it wasn't whatever was in my brain, it wasn't that. But
yeah, absolutely.
when I remember seeing the videos or the images, it was like, oh, it looked more akin to a training video as a or a training facility as opposed to a rehab facility. I am curious. You mentioned the element of proactive. So I'm curious, like, what is that? Um, how do you help the athletes to understand that importance? I mean, naturally, I think about LeBron James. I think we probably, maybe you guys quote as LeBron James. $1 million into his body, saying he's like
Yep.
his, defeating father time and all this. But how do you help that athlete to think about proactive that proactive support as opposed to just reacting to an injury?
Absolutely. Really great question. This is something that I feel like there's a major gap in the sports world. And
Hmm.
honestly, if you think about it, I most things that we do in healthcare in general are is a reactive thing.
Right,
So,
right, right, right.
let's say if you take in like, oh, I go to the doctor and I have high blood pressure, they give you a medication or suggest specific things to ultimately fix the problem versus on the opposite end, if we're doing things to take care of our body, like exercising regularly, having a good diet, all these things that we know prevent high blood pressure, high cholesterol, all that, that's not going to happen in the first place. But, that can get on a whole tangent for for another conversation. But in
Yeah.
terms of, the sports world is one thing that we have offered is kind of connecting with different club teams across the San Antonio area.
Mm.
We've designed injury prevention warm-ups, that take 10 minutes to do. It's not something that takes a lot of time out of practice, and
Yeah.
a lot of things, again, we're just preparing their bodies for the movement that they're about to perform for that specific sport. A lot of injuries happen because our bodies were not properly prepared for, the demands that you're placing them under. So that's something that we've utilized. We also do different like workshops or clinics, as you could say, of reaching out to either coaches of gyms. We've done this a lot with CrossFit gyms of, hey, my
Mm.
members are complaining about regularly having shoulder pain. So
Yeah, yeah, yeah.
going in and educating, like, hey, if this is a common issue, these are the things that need to be done regularly to help it prevent
Hmm.
it from, or help prevent it from being a major problem. Maybe right now it's a minor problem
Right.
and just more of a complaint, I guess you could say.
Sure.
But, you know, providing people with the tools to help, keep it from getting worse.
Hmm.
Um, again, there's been a ton of research done in the sports world in terms of kind of injury prevention training, but now it's the idea of implementing it.
Hmm.
And I think, even just I'm not that old by any means, but
Hmm.
thinking about like what sports were like when I was growing up, and even hearing stories from like my parents or other people that I talk to, there's always been this mentality of like, oh, just suck it up or keep going, or
Right, right,
just
right.
jump into things and don't worry about oh, don't worry about all the extra stuff when we've have research out there that shows some of this extra stuff, whether that's proper warm-ups or whether that's training, strength training, where you're, if you think about a lot of kind of like your traditional lifting, especially in the
Yeah.
high school age population, it's a lot of compound lifts, right? Like we
Hmm.
do squats, we do deadlifts, bench press, incline press, all that, but there's not really a lot of accessory work that's done. And a lot of
Mm.
injuries come up because all your accessory muscles, or whether it's a strength issue, a stability issue, a leg
Yeah.
dominance issue, and so forth. Again, all those things are stuff that could be addressed on the proactive side,
Sure.
and kind of less, you know, less issues later down the line.
Hmm. Yes. One, I want to make sure I highlight for any parents listening. I think any parent can testify that you would not want your child injured in the sport. Now, here's that thing for the parents. When you're thinking about your sports team that your child plays on, the question that made me ask is: Does that sports team, does that sports club have some prevention techniques built in? I mean, it's funny we even say this. Like even with
Hmm.
I started coaching t-ball a couple of months ago, so I think we're like
Yeah.
We're like our last few games of the season. But in my mind, one, we're all like volunteer coaches, so there's like no compensation, which is
Yeah.
completely fine, right? You know, you're just there to serve the kids. But two, it does make you think of, am I, even as the coach, setting up these kids for success to limit the possibility of injury? Which, now that I think about it, like we're not even, stretching or warming up, which makes sense. It's like, hey, that's something to, if my brother listens to this part of the podcast, he's the head coach, I'm an assistant. Um, but no, but to all the parents, does your child's sports club have routines built in and endorsed by a physical therapist like Emily that will help them avoid the injuries ahead of time, so you don't have to have that reactive component of reacting to the injury? How can you be proactive to prevent the injury from happening altogether? So if you know of a sports club, if you're listening and you know of a sports club, and well, you could tag them in the video, or you could send Emily a message, send me a message. I'll be glad to connect you with Emily, so that we can do what's best for the kids to help them avoid injuries, so that they don't have a lot of the reactive treatment needed as they move forward with their athletic journey. Anything you want to add to that piece of it, Emily?
Absolutely. No, I mean, I think you did a really good job highlighting that. I would love to be connected with more teams here in San Antonio to be able to offer that type of education and kind of services as you will, because while I am passionate about treating injuries, I much rather prefer there be less injuries out there, especially in this youth athlete population, because if we're doing the right things for them in the beginning, we're going to set them up for success and ultimately less problems down the line.
Yes, 100%. 100%. Let me ask you about what advice would you offer someone becoming a new physical therapist?
Yeah, really great question. So, my career, I have always been a PT, so I can't necessarily speak on other professions, but I would say that pretty widespread amongst a lot of different jobs is burnout. Something specific kind of in the PT world is that depending on what type of setting you're working in, a lot of times you're working pretty high volume. It can be long hours, a lot of patients, and kind of a traditional orthopedic PT clinic, which is where I started my career. You could see 20 plus people in one day.
Yeah.
And at that point, if that's just what you're doing in the clinic, you also have documentation time where you have to write notes on every patient and so forth. So, you may go home with an hour, 2 hours of work to do as well after working an 8 hour day, or sometimes even longer. So, I think finding something in specific to PT, we have a lot of different specialties. I think we're up to like 9 different specialties that you can be certified in. Don't quote me
Mm.
specifically there because there's been a few new ones added.
Mm.
But doing something that you feel very passionate about. So for me, sports is my passion. It's what I love being around. Um, prior to starting at Puckett Physical Therapy, I was working in kind of a combination sports ortho clinic where I would say about 40% of my caseload was sports, and the rest was just kind of your general population, which don't get me
Mm.
wrong, I did enjoy working
Right,
with.
right.
But I could tell I was much happier. I had a higher caseload of athletes. I found my job more entertaining, and I could just see myself being like more lively in what I'm doing because again, that's kind of where my passion is. So
Right.
now that I am working in a clinic where I primarily just see athletes, I've kind of got that spark back a little bit. So
Mm.
which is really great for me. And So again, I think just finding areas that you're passionate in. In the PT world, you can specialize in sports, you can specialize in just general orthopedics, you can specialize in neuro, cardio, women's health, oncology,
Mm,
pediatrics, geriatrics. Like there's just such a wide variety, and I think finding your niche of what you enjoy
mm,
doing makes a big difference in kind of being successful in your profession.
sure, 100%. You know that one to hear somebody who has that rare ability, and I know it because I talk to people in their career. Because in the coaching world, I'll speak to people who are sometimes dissatisfied with their current career, even if it's a
Hmm.
prestigious career, like they're attorney and they're like looking to pivot out of that. But to hear you're able to capitalize on a passion inside your world, and to also hear there's a bunch of variety of ways that people can use physical therapy in different manners. Um, and I also think about those everybody who loves sports, all the people who maybe dreamt about being a professional athlete, but then we see like the percentages, right, of like the percentages of the people that maybe even dream about it, and even like the whatever the was it the D1 athlete? Is it still like a like what is it like? You probably know the stat better than me, but isn't it like 90% of them still don't make that jump into that professional level? But they're D1. You know what I'm saying? D1 is no joke. As
Yeah,
athletes,
they're pretty elite level athletes.
exactly. And to for you to have a career where you're still able to be plugged in with athletes, it's different than maybe what some people expected. But again, if we're talking 90% of collegiate athletes won't be going pro, then that question does come up. Well, what are you going to do? And what can you do to still stay connected to the game? One way I'm just hearing from you is you're maximizing that passion, you're leveraging that passion into your career in a way that again it makes a significant difference with people's lives.
Absolutely.
Now, if somebody was listening to this episode that could connect you with your perfect referral partner, who would that be? What do they do? I know we kind of maybe talked about some of them already, whether it's club teams, coaches,
Yep.
directors, gym owners. Is there anybody you'd add to that list of like those perfect referral partners for you?
Yeah, so I would say you kind of just hit them all really. But essentially, for our business personally, good referrals are gonna be, you know, any athletes or parents of athletes that have
Yeah.
been suffering from whether it's an acute injury that just happened or maybe chronic overuse injury. We obviously see both ends of the spectrum, and it's limiting their ability to play or even participate in whatever activity that they enjoy doing. That's obviously good referral source. And like you mentioned, coaches, club sports teams, CrossFit gyms, um, club, running groups, cycling groups, ortho or sports doctors, essentially anyone who is either current athlete or even someone that just is more of just like living a active lifestyle that they don't want some issue to limit them
Mm.
from that. That's kind of the area that we target overall.
Yes. Okay. Got it. Got it. You know, it's something I was thinking about, even as you mentioned, an active lifestyle. My wife's a nurse, and then there's a certain number of injuries that
Hmm.
come with that profession as well, right? And because they're
Absolutely.
active all day on their feet, and whether it's the shoes or whether it's the nature of what they're doing. So anyway, so if you're listening, if you want to be able to again express the gratitude, gratitude to Emily for jumping on, please find a way to help me refer more business to the clinic. Help us shoot more clients her way. Um, Let me ask her a question about that while we're on it. Is what has been the best way for the clinic to attract new clients? What's been the best way that you guys have found?
Yeah, so with being a small business, because we are kind of a private owned practice, honestly, our best referral source is our previous patients, previous clients. So people that have had really good experiences with us and they go to share that with their community. One person in particular, or one family in particular, comes to mind. We've treated both of their sons, and they've probably sent us six or seven other soccer players that
Mm.
their kids have played with, and I think that speaks very highly,
Yes.
especially from a parent's perspective. If they're passing on that information to other parents, they
Mm-hmm.
obviously very much value what the care that we have provided. So I again, word of mouth, I would say, is our biggest referral source. Something else is just like building relationships and providing excellent service, like really goes a long way. So that's something that we kind of take pride in with everybody that we work with, with the idea that they would be more than happy to share with family members, friends that, have other issues going on, of like, hey, they really helped me out and they could do the same for you. So,
Mm-hmm.
that we also do is, and we kind of talked about this already, but providing, whether it's a injury prevention warm-ups or doing those different clinics or workshops for gyms. That's a free resource that we provide to people. So, everybody likes free things, and
Mm.
essentially, it all it takes is us, connecting with us, identifying a need that you have, and we're more than happy to tailor that information to help support these communities in whatever way that we can. So I think that's, again, another great way of just building relationships. If we're going out there and doing, team has a ton of sprained ankles. So maybe we go out and we do kind of a workshop on ankle health and what things can help prevent that.
Mm-hmm.
If that's something where they're to develop that patient that we're providing, they're more likely to come see us as well if they
Sure.
have, um, some sort of issue pop up.
Mm-hmm. I love
Um,
that.
I think one other thing that we do that I haven't mentioned, is provide also free injury screens. So we've done that for club teams. We've done it at gyms like, CrossFit gyms or Orange Theory, or different places like that. We've even come out to different running events where essentially we allow people to just come chat with us and say, hey, I've had this going on for X amount of time.
Mm.
What do you think about it? So we're willing to kind of quickly assess that injury and then provide education on what the next best step of action is, and then be able to point them in the right direction.
Yes, yes. Such great insight. I think that again, I think that could definitely help a lot of people with, especially the ways you guys are serving the community. So if you're out there again, you're a part of a team, you're a parent of a team, you're if you've been invited to go to your niece's, nephew's, grandchild's team, um, let's make that connection with Emily. With it's Puckett PT. Did I get that right?
Yes. Yes.
Puckett PT, and help send some connections Emily's way. Let me ask you the last one, Emily, before we wrap up our interview. The last question for you is, what are your favorite qualities of your favorite people?
Yeah. So when I was thinking about this question here, I would say, kind of, I had four ideas that kind of come to mind. I would say integrity, loyalty, honesty, and good communication. And I think it really just breaks down to, providing a, service, or, whatever the term you want to use there, of doing what you say you're going to do. I
Mm-hmm.
think just kind of as simple as that. That's something, I pride myself in personally and professionally, is, providing honest communication, making sure that if I've made a commitment towards something, that I'm following through with that, and then, doing it in the most professional manner.
Yes, yes, yes. It's such a great. It's great to be able to hear qualities like that, because if people think about, if you want, even if it's built in, if you want some of that favor with people, and you get a list of qualities that people have mentioned that are their top qualities, then you can build a favor with a lot of people if you have the integrity, the honesty, the good communication. But Emily, I want to say thank you so much for spending some time with me today, and sharing some of your story and some of your passion in the physical therapy space.
Yeah, absolutely. I really appreciate you having me, Derek. It's been a good talk, and happy to kind of share some information to people out there that maybe don't know what sports PT is.
All right, and to wrap up the episode, I'll let everybody know the sponsor for today's episode is Strong Life Scholars, who's raised thousands of dollars for Hispanic women going to law school, and we're so excited about seeing that organization grow more and more. We want to say thank you for spending some time with us on this episode, and be sure to watch out for the launch of the Change Up Impact podcast, because it hasn't launched yet. We're going to get a few episodes under our belt on the live space, and then we'll get a chance to launch the podcast. So keep an eye out on all of my social media channels, whether you're watching on LinkedIn, if you're watching over on Facebook, YouTube, Twitch, or wherever you're listening. Keep your eyes out for the launch date of our podcast. Remember, and once it's launched, we're going to ask you to subscribe and connect with us. And what we'll do is we'll see you on the next episode. Thank you very much.